Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about colorectal cancer prevention and advances in treatments. I'm here today with Dr. Ludmila Schaefer, Director of Gastrointestinal Medical Oncology at St. Luke's Cancer Institute. Thank you so much for joining us today.
Thank you, Lindsay, for having me.
A new study shows one over-the-counter medication may help lower a person's risk for colorectal cancer. Although there's still much unknown about what exactly causes the cancer, there are still several things you can do now to change the risk factors you can control. Now, a new study has shown aspirin may help prevent colorectal cancer. Can you tell us a little bit about that?
Yeah, aspirin is a very big question in the community. We pay a close attention every time when we see patient here at St. Luke. We ask very specific medications, not only aspirin intake, but also any other medications over the counter. So regarding the aspirin, it used to be known that it could prevent. However, the latest study demonstrated that in the population over 70 years old, it actually could increase and advance disease. But also it's not known in a younger population under 50 years old. So anyone between 50 and 70 years old should discuss with a doctor and be individualized approach. So the jury is still out.
And what should people be doing to help prevent the onset of colorectal cancer?
To prevent onset of colorectal cancer, there are a few things that we could do. Number one, discuss with your family and identify if you have any family genes that would predispose for colon cancer. Number two, if someone smoke, stop smoking. If you don't smoke, don't start. Also, alcohol intake, decrease. Exercise, we recommend 150 minutes per week of moderate exercise and 75 minutes of intense exercise per week. Also, 5 cups fruits or vegetables per day and decrease amount of meat. And the most important, to overall discuss with your doctor what else could be done.
Now, what sets St. Luke's gastrointestinal program apart?
Yes, Lindsay, thank you for asking this question. The St. Luke's gastrointestinal program sets apart a number of things. One, we have multidisciplinary tumor board where we discuss with other subspecialists. We also collaborate with Center for Precision Oncology and treat patients based on molecular profile. We provide the same day appointments. We have special blood-based test that we do as a surveillance, as a cutting-edge technology. We have high-risk genetic program for gastrointestinal malignancies, and we look at the patient from each angle. Once we see the patient, we look at the lifestyle, diet, immune system. We offer clinical trials and treat patient based on personalized approach.
Now, shifting a bit, what are some of the latest advancements in colorectal cancer?
The latest advancement in colorectal cancer really changed for the last 5 to 10 years. Right now, we have a new molecular platforms. What it means that when we diagnose a person with a colorectal cancer, we screen with a specific molecular and genomic profile. What it means that we identify specific signature on the cancer cells and then tailor treatment toward the person. So used to be one size fits all and it's a chemotherapy, but right now we have new immunotherapy, we have targeted therapy, and most of it is based on molecular profile.
Well, thank you again, Dr. Schaefer, for joining us.
Thank you very much, Lindsay, for having me.
If you'd like to find out more about colorectal cancer, including how to make an appointment for a screening, go to stlukeskc.org/colon-cancer. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.